Hi, this is Dr. Casey, and today we're going to look at one of his COVID-19 patients. So I heard you tested positive for COVID-19, and you lost your taste and smell. Today, we're going to learn why Mary lost her taste and smell. She can't even have the cupcakes that her grandma made for her birthday anymore. Today, we're going to learn about the olfactory and gustatory systems and the impact that COVID-19 has on these two systems. The olfactory system is how we smell. The gustatory system is how we taste. Unlike the mechanoreceptors in the ear and the photoreceptors in the eye, the receptors for taste and smell are called chemoreceptors. Odorants stimulate receptors of the cilia on the nasal epithelium. This depolarizes the olfactory sensory neurons and initiates an action potential. All OSNs with the same receptor map to the same glomeruli to form a distinct map. The olfactory bulb passes the information to the olfactory tract. Eventually, it ends up in the olfactory cortex, where information is integrated and processed. Now let's talk about COVID-19. Why do these patients lose their sense of taste and smell? Well, a common symptom of a virus that causes an upper respiratory tract infection is a sudden loss of smell and/or taste. However, there are over 200 viruses that cause URTIs, not just COVID-19. There are a few hypotheses as to why this symptom is so prevalent in COVID-19 patients and why exactly they experience insomnia and ageusia. First, there's viral damage to the olfactory epithelium and olfactory neurons. This is typically because the virus uses the olfactory path as a way to enter the CNS and eventually destroys these neurons. However, these epithelial cells on the oral mucosa are also affected. This may explain why people lose their taste in addition to their smell. The ACE2 receptor used by COVID-19 to enter host cells and infect is widely expressed on the epithelial cells of the nasal cavity and the oral mucosal. This would explain the prevalence of smell loss in patients in addition to taste loss. In addition, ageusia is usually a secondary result of olfactory dysfunction as the brain uses odor to help it process taste. Now here's Mary. In a few weeks, she'll probably be back to normal. Now this is because olfactory neurons are one of the few in the body that are actually able to regenerate. That's all for today. Stay safe, and thank you from Dr. Casey.